Can you show a GARS scoring example? If you are curious about how the Gilliam Autism Rating Scale works and how it is scored, you are in the right place. Let's break it down step by step. The Gilliam Autism Rating Scale, 3rd edition, is a tool designed to help identify autism spectrum disorder in individuals aged 3 to 22 years. It consists of 56 items grouped into 6 subscales that reflected behaviors associated with autism. These subscales include restricted repetitive behaviors, social interaction, social communication, emotional responses, cognitive style, and maladaptive speech. Each item on the scale is rated on a 4-point scale. The ratings are as follows. 0 means the behavior is not at all like the individual, 1 means it is not much like the individual, 2 means it is somewhat like the individual, and 3 means it is very much like the individual. To score the Gilliam Autism Rating Scale, a rater, who could be a parent, teacher, or clinician, will assign a score for each of the 56 items. After scoring, the scores for each subscale are summed to create raw scores. These raw scores are then converted into standardized scores using normative data. Now, let's look at a simplified scoring example. Imagine a rater completes the 56 items and assigns scores based on observed behaviors. Suppose the summed raw scores for the subscales are as follows. Restricted repetitive behaviors scores 25, social interaction scores 30, social communication scores 20, emotional responses scores 15, cognitive style scores 18, and maladaptive speech scores 10. Next, these raw scores are converted into standardized scores using the tables provided in the Gilliam Autism Rating Scale manual. The standardized scores are then combined to calculate what is known as the Autism Index. For instance, let's say the Autism Index comes out to 85. According to the interpretation guidelines of the Gilliam Autism Rating Scale, an Autism Index of 85 might fall into the probable category. This indicates that the individual shows some characteristics of autism and may requiring minimal to moderate support. This scoring process is essential for professionals and caregivers, as it helps them understand the presence and severity of autism-related behaviors. It guides diagnosis and intervention planning. It is important to remember that scoring should be done carefully, ideally by trained assessors, and should be combined with clinical judgment and other diagnostic tools for a complete evaluation.